All right, so you want to know the top 10 questions that are commonly asked to a pelvic floor therapist and pre and postnatal strength training coach. I have them right here. The top 10 questions that majority of the time we get asked as pelvic floor therapists and coaches to our mamas. These are the most top 10 questions that are Googled, that our mamas are interested in learning more about. And today I'm going to answer all 10 of them for you. So let's dive in. The first one: how normal is it to pee a little when I sneeze, cough, laugh, or exercise? So let's back up a little bit. Women are living in pelvic floor dysfunction at the rate of 1 in 3. So 1 out of every 3 women at any stage, this doesn't always mean pregnant or postpartum, this means women at any stage, 1 in 3 right now are living with pelvic floor dysfunction, and leakage is a sign of pelvic floor dysfunction. So when I say it is normal, I say it is more common. This is really because of the lack of education around pelvic health, the lack of education around how to, understand what the pelvic floor is, how to be able to contract, relax, lengthen it, to have it live in optimal function for you. And when those muscles and the surrounding structures, the hips, the glutes, the core, are not working in unison with the pelvic floor, leakage can be a sign and a side effect of pelvic floor dysfunction. So the question is how normal is it to do this? Right now, about 1 in 3 women. I hope that statistic changes as we have more empowered educators and doctors of physical therapy and pelvic floor therapists working with women to raise the standard in this. So I hope you know that this is common. It is not considered normal. It is a sign of pelvic floor dysfunction, and it absolutely can be healed, supported, and reversed at almost any stage and age. Okay, question number 1, done. Question number 2, I was cleared at 6 weeks postpartum, but I still feel so weak. What should I do to get started? Bodyweight exercises first? Okay, so first, I'm going to go on a little bit of a side tangent to this quote-unquote 6-week clearance that women and mothers are just being dished out like it is like the all gold standard cleared. Let's kind of back up a little bit, because as a doctor of physical therapy and pelvic floor therapist, I specialize in rehab, right? When there is an injury at play, we're the team that is meant to help create optimal function in those muscles again, to regain mobility and strength, endurance, and exercise. Okay, so when moms are cleared at 6 weeks, what does clearance even mean? Typically, majority of the time of what we're seeing consistently in current standard of care is that women are cleared without any checkup, without any physical body assessment, and most of the time without even asking really important questions that quote unquote clears them. So this could be a 10-minute checkup in your OB's office that says, oh, yep, you're all cleared because you quote unquote hit this magical 6-week clearance check that clears you for intimacy and exercise without actually giving you a plan that you need. So I totally understand how you might feel a little lost, a little confused, a little alone in how to actually regain your strength. The secret is it's actually never too early and never too late to start rebuilding your pelvic floor and core strength and your full body strength. During pregnancy, we have a significant amount of muscle loss, especially if we are not strength training throughout our pregnancy. And if that carries into postpartum, our body just went through this massive physical transformative thing. Whether you had a vaginal birth, your pelvic floor muscles stretched 2.5 times their normal resting length. Yes, 2.5 times the normal resting length for a vaginal birth. And if you had a C-section, there were 7 layers that were cut or separated to be able to get that baby earthside to you. And so you had major abdominal surgery. In any of these cases, 6 weeks is not enough time to technically consider somebody cleared. So in full transparency, it typically takes about a woman 12 to 18 months to fully start regaining their full muscle strength and ability. And that is also not just on its own. That's if we take a proactive and preventative approach that we're more consistently working on it to rebuild that strength. Muscle just doesn't come back on its own. Strength just doesn't come back on its own. This is something that we actively need to work on to be able to rebuild. When we think about this 6-week checkup, what I see a lot is that women are so afraid to do anything between 0 weeks and 6 weeks. So right after they have their baby, they just wait and they don't do anything until they get the 10-minute all clear appointment. But what I want to tell you is you can actually start immediately after you have a baby. In our line of work, in our world, what we call this is early acute rehab. This is very normal in any other injury, shoulder injury, back injury, ankle injury. We want to start rehab as soon and as early as possible to regain mobility and function and tissue quality, to be able to, present you and set you up for as much success in your healing as possible. Somehow mothers were forgotten in that space, right? And so no matter if you had a C-section birth or a vaginal birth, you can get started on early acute rehab. Now, I say this with a little bit of a grain of salt because there is so much lack of education out there. And at the same exact time, there's so much noise out there. There's so many exercises. There's so many things that people are telling you to do on social media. So in my personal opinion, it's best for you to work one-on-one with a professional, someone like us if you want, 100% virtually, or your local pelvic floor therapist that can also guide you and support you in this way as well. Typically between 0 and 6 weeks, you can really safely get started on some mobility work, some gentle reconnection exercises at your core, at your pelvic floor. We can really start to improve breath mechanics and pelvic floor mobility. And this will all set you up for success as you are starting to gain traction in slowly, progressively, over time, building up your strength. And we typically like to say gravity eliminated first, and we can dive more into that in another video. But just know that 0 to 6 weeks, we can absolutely be doing early acute rehab. If you're working with our team and you start in pregnancy, we just roll straight into early acute rehab in postpartum with you. So you're not lost, alone, or confused in these first 6 weeks where no one's really giving you any rehab guidelines. And then around that 6-week mark, maybe let's say you're listening to this and you are already beyond that 6-week time period and you're like, am I too late? Did I get started too late? No, it is never too late. You can absolutely get started. What we recommend is starting in a backline position first, then a sideline, then a hands and knees position, then more of an upright position, because this increases gravity over time, okay? So if you're still feeling weak at the 6-week mark and you feel like you should be quote unquote cleared for all of the things, just know that your body is still so much in the healing process. You really do deserve a rehab plan. So please reach out to a professional that can guide you and progress you based off of how your body is feeling in the moment, based off of how your birth method went, based off of how you and what those goals are that you might be wanting to achieve later on. So maybe you want to get back into weightlifting or hiking or whatever that might be for you. Okay, question 2 down. Question 3 says, do I have to stop lifting weights or running if I have prolapse? I love this question. This is actually something that I dealt with after my second pregnancy as well. I am a VBAC mama and a C-section mama. So I had a C-section first, and then I had a VBAC at home. And let me tell you, totally different birth experiences, totally different birth methods, and totally different recoveries. I dealt with different things at each birth process and each postpartum. Prolapse can be a scary thing, like, oh my gosh, something is falling out. And so it can be totally normal to feel fear, or it can be totally normal to be in the mindset of like, I can't do anything, I can't push it because something is going to fall out. And while the body might be feeling that panic and that stress, it is very, very uncommon for someone to be at that stage of prolapse. Grade 4 prolapse is what we would call you being at risk of something actually falling out. It might just feel like that's happening to you, but really you just need some proper reconnection, guidance, full mobility in the pelvic floor to be able to get back to weightlifting and running. So just because you have a prolapse does not mean that you're not able to weightlift and to run. But But what it does mean is that you need to be more mindful about your training. You need to be more mindful to work with a professional to get a customized plan and program to be able to help you reduce as many of those symptoms, that heaviness that you're feeling, and slowly and progressively work towards a plan and a program that is going to get you back to weightlifting and running, even if you still have that prolapse, right? So majority of women actually have grade 1 and grade 2 prolapse. They could be walking around town and not even realizing that that's happening unless they were fully assessed. So it doesn't always go off of assessment. It goes off of how you're feeling, those symptoms that you're feeling. And I just want to ensure it is 100% possible to get back to strength training, to get back to weightlifting, even powerlifting. We've helped lots of moms that thought that they were on the verge for surgery with their prolapse, and we worked with them over a 3 to 12 month time period based off of, them. And we've been able to get them fully back into running strength training without their prolapse even bothering them. So you can definitely do it. All right. Question 4, I think we're on now. How do I know if I have diastasis recti, and can it be fixed without surgery? So, wow, diastasis is like quite the talk of the town here on social media now. And I'm going to clear up a couple myths of like, how do I know if I have it? Here's the truth. Nearly 100% of women at the end of pregnancy have some form of diastasis, okay? Some form of diastasis. So with pregnancy, it is very normal. It is physiologically normal for the tissues, that linea alba, that connective tissue that goes right down the midline, to thin and widen and weaken even, right? Because we have to make room for baby. As your belly is expanding, so are your muscles, and so is that connective tissue as well. So nearly 100% of women at the end of pregnancy will have some form of diastasis. That doesn't mean that we're all doomed and we should just not do anything, because the goal during pregnancy is to try to limit as much separation as possible, as much weakness as possible, and to limit as much widening as possible, right? So we can do that through continuing to strengthen the core in a safe and healthy way in pregnancy. Core exercises are not off in pregnancy. We just need to modify them a bit to rearrange your position to make sure that you're activating correctly, so that we can continue to keep those muscles and those core muscles and that connective tissue as strong as possible in pregnancy to limit as much of that gap as possible. Okay, so I like to back up all the way to pregnancy because it is very common and it is very normal and physiological normal for it to happen. We just want to limit the amount of separation, or the gap, if you will. Some things that you can be on the lookout for it to know, am I managing my pressure appropriately in my core? Am I at more concern for diastasis? As we typically look for coning or doming at the midline. So sometimes that can look like if you're lifting or working out, or if you're even getting out of bed in the morning and lifting your head up, do you see kind of like a bulging or a coning at that midline? And if you do, that tells us that maybe you're not managing the dispersion of pressure as best as we could. And maybe that's because there's miscoordination or lack of endurance or weakness at the core and at the connective tissue, where it could be held a little bit better together. So it's not really about preventing diastasis. It's about managing it, being educated, and continuing to keep your strength alive in pregnancy. And then when we move into postpartum, some of the current literature right now shows at about 6 weeks postpartum, about 50% of the population will have a resumed quote unquote normal diastasis return. The other 50% has to work a little bit harder, right? This could be environmental, it could be genetics, it could just be how many pregnancies you've been through, how many postpartums you've been through, how well you kept up your strength in pregnancy and then in postpartum. It could be due to a lot of factors, but about half of us are going to have to work a little bit more intently, a little bit more intricately at the diastasis to be able to see healing and resolution. Okay, what does healing and resolution mean? We want to see less than 2 fingers width in the diastasis, and then that's considered more in normal ranges. So If we're at about greater than 2 fingers width or 2 knuckles deep, this would be more of a concern for a more severe diastasis that you should definitely get some focused support. So you don't always need surgery. I would say majority of women in general, majority of mothers in general can heal and get enough support at their core and at their midline to be able to heal their diastasis without surgery. A lot of the times when surgery comes into play, it might be more for cosmetic reasons than anything else, or it is a more severe case, which is more rare. So majority of people can just have conservative management, rehab exercises with a professional to be able to heal your diastasis. Okay? Question number 5. Can sex ever feel good again after having a baby? It's been 1 year of discomfort. So first of all, whoever submitted this question, appreciate your vulnerability. It is really hard to talk about and can be talked about as well. About 50% of women will experience pain with intimacy in the first year postpartum. But that does not mean that it can't be improved, right? A lot of women will find relief with specific pelvic floor guidance, pelvic floor rehab within as early as 6 to 12 weeks of getting support. So for a lot of women, for a lot of mothers, this can be supported and healed, and you don't really need to suffer the whole year unless you want to, right? Sometimes after that year-long mark, it can improve or go away. And some thoughts are due to hormonal changes that are happening, lubrication changes that are happening, just an anatomical changes that are happening. It could also be due to less stress. It could be due to less environmental factors that are causing intimacy to be painful. There's so many reasons of why that might happen. But majority of the time, what we actually see is women can be experiencing pain with intimacy even before they give birth, before they even were becoming pregnant. So if this has been a long-term thing for you and you've just increased this discomfort after having a baby, it's definitely time to seek out a professional. If you're just a few months out and maybe it's the first or second time that it's happening, it could improve on its own, but it's never a bad idea to get support on board to just accelerate that healing process as much as possible, because typically we see it happen for a few different reasons. There could be scar tissue present. There could be just a constriction going on, more of a hypertonicity or, more tension at the pelvic floor being held there. Could also be a lot of other factors like I talked about earlier, hormonal, lubrications. There's different positions. There's so many strategies that as pelvic floor therapists and, as we work with our clients one-on-one, we can absolutely see a lot of resolution with this pain very quickly. And like I mentioned before, just even in a few months. So there is no reason to suffer for a year. Sometimes it's just lack of education. Totally get it. Just know that healing is possible and you deserve some support at this time. All right, next question. Why does my core and pelvic floor feel worse after Kegels and deep core work? I love this question and I hope that you are listening. Kegels and deep core work can absolutely make your symptoms worse and oftentimes are not even necessary to resuming full resolution in your strength. So one sign and symptom for you, if you are noticing pain increasing or discomfort increasing, or maybe your symptoms are getting worse, pelvic pain, hip pain, tailbone pain, pain with intimacy, maybe your leakage, prolapse symptoms. If you're noticing these symptoms getting worse and increasing after you're doing Kegels or core work, it might be because you're actually dealing with what's called a hypertonic pelvic floor, where the pelvic floor is living in a bit more of a constricted, shortened, tightened state. And so more Kegels and more deep core work is actually just really pissing off those muscles even more. And you're thinking about them already being tight and constricted, and you just keep shortening and exercising and stronger, and those nerves and those muscles are really unhappy. So oftentimes what we see with people who are experiencing increase in their symptoms or increased pain with Kegels and pelvic floor work and core work, they're like, it's actually making things worse. really a sign that we need to back off on the Kegels, back off on the deep core work, and really focus more on nervous system, what's called down regulation, where we allow the pelvic floor and the core muscles to release, to learn how to lengthen for you, not just shorten, and also learn how to completely elongate so that we can restore more optimal range of motion in the pelvic floor and core, right? So a lot of times people think, oh, it's because I'm weak. I need to do more exercises. Well, weakness can also come if those muscles are too short and too tight. That can also increase weakness. So number one step is getting full range of motion, kind of leaning more into elongation work, learning how to lengthen those muscles, how to relax those muscles, and doing more of that type of work over a period of time versus more Kegels and more deep core work. We see this a lot with a lot of clients that come to us. And so the first thing we're doing is stopping all of that extra pelvic floor and core work. Okay, next question. Is it too late to heal my pelvic floor and core? I'm 6 years postpartum. Great question. It is never too late, and it's never too early either, but it is never too late to start working on your pelvic floor and core healing. So a lot of times we will have moms reach out to us just like this one, that's 6 years postpartum or even 10 years postpartum or maybe even 30 years postpartum. And they wonder, is it too late for me? Am I too far gone? And we forget that the muscles down at the pelvic floor and the core are just like any other muscle in the body, right? So if we wanted to make our arms stronger and we start actively strength training and getting good mobility and start adding more resistance to those muscles, even if you're 65, your brain and your muscles will still respond and they will still increase in strength and mobility. So it is never too late to get started. You're never too far gone. It's never like, oh, I wish I would have done that when I had babies and now I'm too far gone, which we might hear from our mothers or grandmothers, but even them, they can absolutely still see reverse in leakage, reverse in pelvic heaviness, and really heal their pelvic floor and core at any age. So it is never too late. We have worked with, clients as early in their mid-20s all the way up into clients into their 60s, and you can absolutely see changes at any age. Why didn't anyone tell me about pelvic floor rehab after birth? That is such a good question, Mama. I mean, honestly, why didn't anyone tell you, right? That is literally why this podcast, this is why this, my company, your Postpartum PT and Wellness exists. And exactly how I felt as well, being a doctor of physical therapy. I worked in orthopedic medicine for many years, was a clinic director, and then became pregnant and then had a baby and then had a very unexpected and unplanned cesarean, which was my first surgery ever, first major abdominal surgery. And after I had that surgery, no one said anything about physical therapy, occupational therapy, or rehab. All I heard was, don't do this, don't lift the baby, don't drive, all the things that I couldn't do, don't go upstairs, but no one was giving me a proper C-section recovery plan. Then moved on to my VBAC, and same thing. There is no proper recovery plan for moms out there. So this is literally why I created this company, is to be able to help raise the standard and close the gap in care for women and mothers in pelvic health, but in pregnancy and postpartum, because mothers really aren't given the tools and strategies they need in the current setting and society and system that we live in right now. So hopefully for our daughters, this will be different. But right now, it is really our responsibility as women and as mothers to advocate for ourselves, to ask for support, to invest in support on our own, to be proactive and preventative in pregnancy, and then to get early acute rehab so that you don't have to live a life with pelvic floor dysfunction, and so that you don't have to wait for somebody else to tell you. But I agree with you. We really do need to be making it part of standard of care, where every mama that is pregnant is getting the support that she needs during pregnancy to maintain her strength, to learn about push prep, to learn about the birth experience and how to support her body and her core and her pelvic floor during that birth experience, not to mention all the other things that go into that, but also into postpartum as well, and really formalizing a clear recovery plan for moms to be able to heal and to know that there's support and healing out there for them. At this time, you're just going to have to continue to self-educate and reach out to people that you trust, that you're looking for support in healing and recovery with. Okay, 2 more questions for you guys that you submitted in. Do I have to get an internal exam to fix my pelvic floor issues? This is another really great question because with more education circulating on social media and out there about pelvic floor rehab, a lot of women and mothers are concerned that they have to get this internal exam when they go to pelvic floor rehab. So I want to just kind of break that myth and believe that you have to. So number 1, your body, your choice. Any provider that is doing pelvic floor therapy should be informed and should be asking for consent. If you are going somewhere in person, you always have the option to opt out. You always have the option to say no. You always have the option to say maybe later. But also, interestingly enough, what we're finding, especially because we do 100% virtual support through pelvic floor rehab, pregnancy, strength training, postpartum, all of those things, we ourselves have found that being 100% virtual with women, they get the same results, if not better results and faster results, because we're able to be more communicative with them through the program. There's more conversation, there's more program changes, there's more access to support, especially for our mamas that live in rural areas, and there's less barriers to care because the number one reason people don't go and seek out support for themselves in pelvic floor rehab is they don't have childcare, they don't have support, they can't get to and from appointments. So for us, one of the reasons we are virtual and love being virtual with moms is having that holistic picture of rehab and strength training, nutrition, stress management, all of those things, but also because we're virtual and it's accessible and you're able to get incredible results. This is not just, subjective either though, because when the pandemic happened, there started to be a massive increase in research that was collected for telehealth, pelvic floor telehealth, right? What a randomized controlled study found was that at the 12-week follow-up and at the 1-year follow-up, there was no difference in outcomes or satisfaction at the 12-week follow-up. So whether somebody went in person or whether somebody got virtual support, there was no difference in outcomes and there was no difference in satisfaction at the 12-week follow-up. And this obviously included no internal exams virtually, right? What they also found at the 1-year follow-up was the results sustained similarly in both groups, but satisfaction was higher in the 1-year follow-up. And they didn't really allude to why that might be, but it is interesting that satisfaction was higher in the virtual group. I can only imagine it could be because, maybe as a mom myself, the fact that I didn't have to drive anywhere, put kids in and out of the car and, wrangle car seats and strollers and snacks and iPads for kids so that I could get the rehab that I needed, especially if they didn't have childcare support, but they still got the same outcome and results. So that's my personal anecdote. They didn't really include that piece, but just to share with you, whether you decide to go in person or decide to do virtual support, there is very limited research on there being much difference, and in any case, similar outcomes. So it is your choice. Okay, last question here for our 10th question. When is a good time to focus on weight loss after birth without tanking my breast milk supply? I love this question as well because I think that it also invites us to be able to be more clear on our priorities and what we're focusing on in this postpartum space. Like I said, I have 2 babies. I completely understand the desire to want to start feeling like yourself again and feeling confident in your body and regaining your strength and fitting into those clothes that you love, that you bought previously. But it's also really important to do things in the right way. And I hate to say right and wrong, but we often see so many times moms only focusing on weight loss that they just jump straight into a workout program, whether it's Bodyweight or with weights, or they immediately just hire a fitness coach because their main goals are weight loss. And then to come to find out they're peeing their pants while they're doing their workouts, or they're experiencing pelvic heaviness that's getting even worse as they're working out. And just feels kind of counterintuitive Our approach is that we definitely want to get you back into strength training. We definitely want to help you feel confident, and we definitely want to help those side effects of nutrition and strength training, the byproduct of body composition and weight loss to happen without tanking your breast milk supply, okay? But most importantly, we want to focus on nutrition first as the primary thing. So after you have your baby, really focus on fueling your body appropriately with as many whole foods as possible, getting enough protein and carbs as possible, because breast milk supply is actually more tied to your nutrition than it is over exercising. So there used to be this myth that, ever since I started trying to lose weight or I started exercising, my breast milk supply tanked. And more commonly, what the research is finding is it's not exercise itself that's causing a reduction in breast milk supply. It's actually the fact that this person is in the mindset that is now limiting their food intake. And they're limiting their food intake because they're trying to have the goal of weight loss. And so when we limit our food intake, this can dip below the caloric needs that our mamas need to be able to sustain their breast milk supply, to be able to not stress out their body in that aspect as well. So what we're finding is stress in food intake is more indicative to breast milk supply than exercise alone. So as long as you're fueling appropriately and being mindful that you might need a few hundred extra calories in your diet if you are exerting more energy via exercise and you're being accommodating to that, you can really safely start to focus on more body composition or weight loss goals around that 3 to 6 month mark if that's your goal. But majority of the time, to be honest with you, we really love no earlier than 6 months, because that 0 to 6 month phase is a really nice time to mostly focus on your nutrition and your pelvic floor and core rehab. And then we start transitioning moms, especially if we get them started early, around the 4 to 6 month mark on more strength training with, aesthetic goals, if that is a goal of yours as well. But it doesn't have to be, right? So we can also just reduce the narrative that we have to bounce back, and we can drop that as well. And we can just focus on feeling good in our bodies and rebuilding our pelvic floor and core strength and starting to strength train. And to be honest with you, body compositions and weight loss will happen as a byproduct. It doesn't have to be something that we always focus on. So that's it. The 10 top questions that are mostly asked and researched and people are looking for out on the internet and submitted by our community to us to answer as a pelvic floor therapist and pre- and postnatal fitness coach. I hope you enjoyed them. Let me know if you have any questions.